Greetings, John Rice here with the Lien Project Network. Today we're on Medicare Module 106 called Medicare Advantage Plans on the Rise. What are we going to cover today? Well, we're going to talk about the basics of Medicare Advantage plans. What are they? And in particularly, how can a Medicare Advantage plan impact your personal injury claim? So, I call these the bigger problem. If you're familiar with regular Medicare and its rights under the Secondary Payer Act, i.e., their super lien, then you'll recognize that if Medicare assigns or gives statutorily a different entity that same super lien, it's something that you ought to pay attention to in your PI cases. It is really the bigger problem. So, look, we've got Medicare Advantage organizations. They are the insuring entities like Aetna or Blue Cross Products or Kaiser, someone who has a Medicare Advantage plan. For purposes of the discussion here today, MAO and MAP for Medicare Advantage Plan are sort of used interchangeably, all right? So, what is an MAO? An MAO is a private healthcare entity that contracts with CMS to provide Medicare beneficiaries with services that Medicare Parts A, B, and D would otherwise cover. CMS pays the basic premium, and the beneficiary often pays a small monthly premium. So, what you have is a private insurance entity who goes to Medicare and says, "Hey, Medicare, we will provide a Medicare beneficiary not just what would be covered by Medicare AB and potentially the D plans, the prescription plans, but we're going to give it all to them. And we're not going to have any gaps, right? We know that Medicare itself doesn't cover all care. There are limitations in the care you get from Medicare. There's limitations on the number of hospital days, for instance, that you get